One of the amazing things about the University of North Carolina is our core services, and I think it's something that separates us from almost any other university.
Our core facilities offer an amazingly wide range of services, including cutting-edge technologies, high-end instrumentation, technical support, and education. Collaboration defines UNC research, and this is made possible every day by our core labs.
UNC is nationally recognized for its research excellence, and the School of Medicine supports a large, thriving research community that receives more than $600 million in research funding annually and consistently ranks among the top biomedical programs in the country. Our investigators are part of a community that incorporates researchers from the School of Medicine, Dentistry, Public Health, Pharmacy, and the College of Arts and Sciences, all together on the same big campus. Our robust research infrastructure leverages more than 95 state-of-the-art School of Medicine core facilities.
As a member of CFAC, I have the privilege of working directly with scientists in animal model course. Our course provides clinical chemistry, CRISPR-Cas gene editing, transgenic and xenograft models, histology, pathology, imaging, and also many surgical services. I also have a very active research program which relies on core facilities. Our research program would not even be possible without this very specialized expertise and dedicated services provided from this course.
The Pathology Services Core was formed from a merger of the Animal Histopathology Core and the Translational Pathology Lab. We offer basic histology, tissue microarrays, immunohistochemistry, digital pathology, and digital spatial profiling for both preclinical and clinical research.
We currently support, I would say, around 150 studies, and with the help of our wonderful faculty advisors, we are able to help investigators plan the most effective studies. And at the same time, we serve kind of as an extension of their very own lab.
Having spent most of my career working in industry, I did gain a strong appreciation for the importance of standardization of processes and procedures. For core labs especially, standardization increases customer confidence, optimizes workflows, and drives continuous operational improvements. Standardization is normally accomplished through defining our processes and procedures in SOPs, or standard operating procedures. Following these SOPs and thoroughly documenting all of our observations and results supports rigor, reproducibility, and transparency, all key principles for generating high-quality, next-generation and high-throughput sequencing data for our customers.
The ProCore provides two sets of services to support research with patient-reported outcomes. Patient-reported outcomes collect information about symptoms and quality of life directly from patients.
We have an electronic data capture system that's built specifically for patient-reported outcomes. That includes web-based surveys, automated telephone surveys, and also things like collecting data from wearable devices.
The Clinical Translational Core of the UNC Intellectual and Developmental Disabilities Research Center provides a core access to critical methodologies, equipment, and expertise to support research in the area of developmental disabilities. Amongst the resources that the core provides are access to sophisticated behavioral measures that allow us to map age-appropriate maturation of cognition and behavior and emotions. The cores across campus are really critical for fostering interdisciplinary work. They bring together scientists across disciplines, from psychology to public health to biology to neuroscience to molecular biology to behavioral biology.
I think that compared to other places, our lab core directors really make the facilities stand out.
It's very convenient just to walk over a building and ask a core director a question, and they're so open to your questions and comments about how to make your science better and how to do more interesting research.
We find the cores are essential to what we do. There are many technologies that are beyond the reach of a research lab, and we find that the cores provide both the technology and the expertise to apply it in our research. Some of the cores we rely on are the Marsico Lung Institute Tissue Procurement and Cell Culture Core, the Pathology Services Core, Histology Research Core, High Throughput Sequencing Facility. There are many others, but these are some of the ones we rely on most.
The scope of our core facility includes breeding, housing, and the care of the zebrafish colonies, ensuring their health and also genetic integrity. We also provide researchers with access to high-quality zebrafish strains, assist in experimental setup, and offer technical expertise in zebrafish husbandry and the manipulation techniques.
The cores are particularly important for launching the careers of early investigators. These are expensive pieces of equipment. These are deep expertise areas that really come to life when investigators collaborate with each other and enrich each other's area of work.
And to me, that's what makes UNC a great place, just to have these resources at our fingertips to do bigger and, quite frankly, better science.
The shared resource model really exemplifies collaboration.
Since core laboratories generate much of the data for scientific publications, it's important to accurately track and capture these papers. Our office has formulated a robust and innovative search process, showing that UNC's School of Medicine core laboratories have been acknowledged more than 900 times a year in peer-reviewed publications since 2017.
Continued investment in core infrastructure and cutting-edge technologies will secure UNC's long-standing position as a highly impactful, multidisciplinary research enterprise.